This is the first in our series of webcasts about Edgewater's Accountable Care Analytics application. To learn more about our ACO expertise, please visit our introduction video by clicking the link below. This webcast will demonstrate patient panel definitions in the ACO Patient Summary. Examples of patient panels are: who are my patients? Where are their treatments? What other providers are they seeing? These may seem like simple questions, but there are many complex relationships that can be represented in the healthcare environment. Understanding them is critical on the path to population health management. Let's take a look at a few of those patient panel dashboards. These dashboards were created with Microsoft Power View. In this first dashboard, I'll use chronic conditions as the criteria for patient panel definition. I could use a dashboard like this to find high-cost patients, look at patients that could benefit from care management follow-up, or evaluate patients for a potential research study. On the left, I have several patient panel criteria slicers. I'll select the slicer for cancer. Notice that all of the other slicers and visualizations are filtered by this one slicer. Now, I'll add specialties. I'll add cancer and orthopedics. On the right, you'll see that my patient counts, my reimbursements, and my contribution margins have been filtered, and I have this distinct patient list of many thousands of patients. Next, I'll apply a filter, for example, just sleep records from the year 2009. And I'll only look at patients with a total reimbursement that is greater than $10,000. As you can see, I've narrowed the list from many thousands of patients to just 281. The next dashboard is the ACO Patient Summary. In many situations, individual data points are needed for care management or provider follow-up. With this dashboard, I have basic patient demographic information, a list of the in-network care that was provided, a list of the out-network care that was provided, and a list of related diagnoses and procedures. I see that there was significant expenditure in July of 2008. I'll filter this entire view to look at more details for the second and third quarters of 2008. Now, I can see the specific procedures from that time frame, and I can also see where I may need to seek additional documentation for follow-up care. To summarize, we've been able to categorize patients by their chronic conditions. We've also gained a comprehensive view of relevant clinical measures and financial activity for those patients, using the ability to cross-filter all or individual objects. The data and features on these dashboards have allowed us to answer, who are my patients? Other benefits include the ability to assess the impact of a specific type of care or alternative therapy. They can also be used as case studies, as a basis for follow-up, or to validate medical history.